we are going to talk about pain relief and management. Pain relief and management is one of a very important area in counseling in health psychology. Today's lecture's contents are pain relief and management, what is pain, acute and chronic pain, what are the different ways to control pain, techniques, biofeedback, hypnosis, relaxation training, and acupuncture. Pain relief and pain management both are one of the very important things which are being excessively used in counseling in health psychology, because when all the treatment modalities stop working, pain management is the only way to deal with those patients who are chronically sick. Pain management covers a number of methods to prevent, reduce, or stop pain sensation. These include the use of medication, physical methods such as physical therapy, and psychological methods. These are the things which are very much used in patients who are under the treatment of cancer, and when chemotherapy and treatment for cancer stop creating its effect and it started losing its effect, pain relief and management techniques are being used to reduce the pain of cancer patient. Pain relief and management can mean that a patient no longer feel anything in an area that once hurt. This seems to be very difficult and almost an impossible thing, that how a technique or a management therapy can produce results like that, but it can means that the person feels sensation but no pain. Now, looking at how pain is being described and understood. The International Association for the Study of Pain, IASP, defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Whenever we feel pain in any part of our body, it means that there is some tissue damage which is probably going to be at a sensory level, or maybe because of some emotional experience we have attached a kind of sensation of pain for that area. Pain occurs when something hurts, causing an uncomfortable or unpleasant feeling. Let me tell you one thing, that this kind of pain is definitely different, which is being reported by the person who has psychosomatic problems, because the psychosomatic problems have another kind of connotation, whereas the pain which are being created because of the physical sensation, they are being influenced by attitudes, beliefs, personality, social factors, and can affect emotional and mental well-being. Looking at the example of COVID-19 pandemic these days, you all know that when there is a reporting incidence of COVID-19, the people are living around that person, or those who are being in contact with that person for the last few days, they feel that they may be going to affect because of being in contact of that person. So they unknowingly started reporting the symptoms which are very much similar to the person who have this kind of problem. So this is basically the kind of the attitude and beliefs and social factors which are affecting one's emotional and mental well-being, right? Pain is a complex process, and it involves both the peripheral nervous system and the central nervous system. You all know that the behavioral neuroscience has described all kind of emotional and sensational behaviors which are being related to central nervous system and peripheral nervous system. Tissue injury activates the peripheral nervous system, which sends signals through the spinal cord to the brain where pain perceptions occur. So this is the basically the neuropsychology of how the brain started working. Acute pain is usually comes on suddenly. It's intense, it's fast, and is caused by something specific. It is sharp in quality, and acute pain usually does not last longer than 6 months. It goes away when there is no longer an underlying cause for the pain. After acute pain goes away, a person can go on with life as usual. Looking at the causes of acute pain, it includes the pain can be occur in result of some surgery. It could be due to broken bones. It could be because of some dental work. This may be the result of some burn or cut. It could be in result of a labor pain or a childbirth. There may be other reasons as well, but these are the most significant. Chronic pain is a pain that is ongoing and usually lasts longer than 6 months. This type of pain can continue even after the injury or illness that caused it has healed or gone away. Pain signals remain active in the nervous system for weeks, months, or years. Some people suffer chronic pain even when there is no past injury or apparent body damage. Looking at the examples of the chronic pain, it is linked to the conditions which includes headache, arthritis, cancer, back pain, and there can be many others. People who have chronic pain can have physical effects that are stressful on the body. Stressful effects includes tension in muscles, limited ability to move around, a lack of energy, and appetite changes. Emotional effects of chronic pain include depression, anger, anxiety, fear of re-injury or fear of recoming the disease. Such a fear might limit a person's ability to return to their regular work or leisure activities. Looking at the example of cancer patients, which is most pertinent to that emotional effects of cancer include depression, it includes anger, it includes anxiety, and the fear that yes, the cancer cells can come again and they can damage the person. And because of that fear, most of the people started staying at home most of the time. They stay in their beds and they lost hope, and they feel that they don't have energy to do anything. Their appetite changes, and they have continuous feeling of tension in their body parts and their muscles, and a lethargy, and they think that life is no longer going to be the same for them. And because of that hopelessness, sometimes the cancers aggravate because it has strong link with depression and anxiety and stress, and the person become more vulnerable towards very negative symptomatology of cancer. Looking at the different ways to control pain, the most important, of course, on which most of the people go for is pharmacological control of pain. When the pharmacological control of pain does not work, people like to go for surgical control of pain if there is an option available for that. Next one is the sensory control of pain. And the last one, which after all the treatment modalities have failed to produce their effectiveness, is psychological techniques for management of pain. Let me tell you that these days, since we feel that medications and doctors and healthcare services are very much expensive in private sector in Pakistan, where you can think that some better medical treatment could be provided to a person. When all medical doctors says to a patient that they don't have any treatment for them, they send them to the highly expensive doctor who is the pain management expert. And pain management expert is a one who uses his medical information, his medical experience along with the psychological techniques for the management of pain of that person, no matter what disease it is. Looking into the details of pharmacological control of pain, you know that the traditional and most common method of controlling pain is through the administration of drugs. Highly effective painkillers are most popular for controlling the pain temporarily. It is backbone of pain control, especially in case of severe pain, because whenever there is a severe pain, the first thing which a doctor has to give is a pharmacological control. The surgical control of a pain also have an extensive effect, because at times there are the kind of the pains which are being temporarily controlled because of the pharmacological use, but they are being there because the surgical treatment is being needed. So surgical treatment involves cutting for creating lesions in the so-called pain fibers at various points in the body, so that pain sensations can no longer be conducted. You know that there are certain treatments in which the surgical control of pain is very, very important to do. For instance, there are some pain in the nerves, there is some pain in some body parts because of the bone edges are sharp or things like that. So in those situations, although the surgical procedure is very critical, and at times because of age and gender it could be life threatening, but still doctor go to choose surgical control of pain because they find that there is still a good amount of hope for the patient to get better. Sensory control of pain is one of the oldest known technique of pain control in counter irritation, a sensory method. Counter irritation involves inhibiting pain in one part of the body by stimulating or mildly irritating another area. This is something which needs a mastery to be done to use this kind of a method. And in this method the involvement of patient is very high. He would be actively mindfully engaged in this treatment pattern, because if a pain is there in one part of the body, the counter irritation another in another part of a body, a pain would be induced, and patient would be automatically focusing all of his you know um, attention towards the new sensory pain center. So because of that he would be probably feeling less pain in the actual part of the body where there is pain, but he was thinking about the one where the pain has been basically inhibited. But in psychological techniques for the management of the pain, this has just been done on mental level, on psychological level. There would not be the inhibition of a pain in one part, or inducing of a pain in one part, but this would all be on a psychological level. लाइक जैसे आप पेशेंट को कहते हैं कि आप फोकस करें कि आपको एक सीवियर या एक्सट्रीम पेन हो रही है आपकी लोअर बैक में, जबकि उसको जो पेन जो है वो उसके एब्डोमेन में हो रही होती है. सो बाय फोकसिंग द सेंटर ऑफ अट्रैक्शन attention of your mind from one side of your body to another side of your body, आपकी जो कंडीशन है वो उसकी फीलिंग्स पेन की जो है वो चेंज होना शुरू हो जाती हैं. Psychological techniques required active participation and learning on the part of patient. Therefore, the psychological techniques are most effective for managing slow rising pain. These psychological techniques are again interestingly the same one which we have been talking about since the beginning of this semester, and they include biofeedback, hypnosis, relaxation and acupuncture. So you can see the effectiveness of these techniques, because in various issues and in various health problems you see the effectiveness of these techniques, that they came into use again and again for various problems. So as you all know that biofeedback is something which is going to give you a complete detail of your all body sensory methods, like your temperature, your fever, your heart rate, and anything which is related to your body. It's a method of achieving control over your bodily processes that has been used to treat variety of health problems. Especially it is very good to be used in stress, hypertension, muscle tension, headache and migraine headaches. Although we have talked about in detail about biofeedback, but just give you a recap, it comprises a wide variety of techniques that provide biophysiological feedback to a patient about some bodily process of which the patient is usually unaware, such as blood pressure and heart rate. These functions are tracked by a machine, and information about a function is passed on to the patient. For example, heart rate may be converted into a tone so the patient can hear how quickly or slowly his heart is breathing. The patient then attempt to change the bodily process through trial and error and continuous feedback from the machine. The patient learns what thoughts and behaviors will modify the bodily functions. So this is how the biofeedback works. Although it is not always clear to the patient exactly what he or she is doing that to achieve a success, the patient may still become proficient or controlling a body functions that was one automatic. For instance, you see, when we keep on saying someone that you can perform better, one day you feel that a person is trying and started trying, and eventually he is doing that in a better manner, whatever the task it has been assigned to that person. So similarly, because of biofeedback, when you continuously feel that your heart rate is not appropriate to the mark, like it's getting very fast and you have to reduce that in order to get control over your body, or for instance you are breathing very fastly, these kind of feedback gives you an option to work on yourself, and after some time you usually would be able to make some changes on your own without the need of the machine. The second important thing we talked about is hypnosis, and we have looked at two different traditional and conventional methods of hypnosis. Hypnosis trance like state in which person have heightened focus and concentration. It is done with the help of verbal repetition and mental images. It helps you to cope better with anxiety and pain. Now, how hypnosis work? As an intervention, hypnosis relies on several pain reduction techniques. First state of relaxation is brought about so that trance can be introduced. Relaxation alone can of course help reduce pain. Next, the patient is explicitly told that the process will reduce the pain the patient is having. The suggestion that there will be a decline in pain is also sufficient to reduce pain. When you are in a state of hypnosis, you follow all kind of suggestions which are being given to you by the therapist. For instance, in hypnosis, when this has been sent to the client, that you have to forget everything which was done in a bad manner to you in past, it works. So similarly, when it is being suggested to the client that there is no pain and you are not going to feel any pain, only this suggestion that pain will decline is also sufficient to reduce the pain. Hypnosis is itself a distraction from the pain experiences, and distraction can reduce experience of pain. So this is one of a very effective technique, and in West this is still being used in different in management of different acute pains. So how hypnosis is effective? Efficacy of hypnosis for the management of some acute pain is now established. It has been used successfully to control acute pain because its result has been seen in childbirth, dental procedures, burns, headaches, and medical procedures. It also has been used with success in treatment of chronic pain, such as that due to cancer, and in conjunction with other pain control techniques. So you see, we do not think that hypnosis could be as effective, that it could be used in so many medical conditions, but when we see that how it has produced result, we have to believe that yes, hypnosis is a technique which could be used in management of pain. Now looking at relaxation techniques, relaxation training has been employed with the pain management extensively, either alone or in concrete with other pain control techniques, originally developed to treat anxiety related disorders. Relaxation provides coping with stress. One rationale for teaching pain patients relaxation technique is that it enables them to cope more successfully with stress and anxiety. In relaxation, an individual shifts his or her body into a state of low arousal by progressively relaxing different part of the body, as you have learned in Jacobson 16 progressive muscle relaxation technique. Controlling breathing is an important component of relaxation. An alternative method of inducing relaxation is through meditation. Relaxation may also affect the pain directly. For example, the production of muscle tension or the diversion of blood flow, which is induces by pain made used pain that are being tied to the physiological process. So relaxation is more successful with acute pain and also in treating chronic pain when used in conjunction with other methods of pain control. So this is just not a simple relaxation training method to control on your breathing and things like that, but it has way long to go. Last one is the acupuncture. Acupuncture is a Chinese method of treatment, and in this treatment, long chain needles are inserted specifically designed into the area of body that theoretically influence the area in which a person is experiencing a pain. The main goal of acupuncture is to cure illness. It is also used in pain management because it appears to have analgesic effect. During surgery, these patients are typically conscious, fully alert while the procedure is being going on. Acupuncture control is not fully known that how possibly these acupuncture functions are partly as a counter irritation method of controlling pain or otherwise. Before acupuncture, patients are really fully prepared for it, and they were being told that what is the sensation and how they will be tolerating them. So because of being this preparation, they reduces fear and increased tolerance of pain is there. Acupuncture needle and the process of inserting them are distracting accordingly. Attention may be distracted away from pain, and patients undergoing acupuncture have received an analgesic drug of various kinds, which also reduces the pain experiences. So basically, acupuncture gives you a kind of an idea in which the pain is being given into a certain part, and the increased feeling of tolerance of pain has been induced, and you distract yourself, and your attention may be distracted away from the pain because you are feeling the pain of the needles in another part of your body, right? So this could be considered as a counter irritation method as well. So it can is acupuncture effectiveness, it can have reduced some kinds of short term pain, but it may not be as effective for chronic pain, because temporarily acupuncture and other less traditional methods for pain are sometimes regarded with suspicion by care organization which certify different management techniques. They have really some questions on efficacy and on use of these kind of treatments, so they are not much being used for chronic pain, but in acute pain, in some countries this kind of method has been used. In Pakistan, you have seen that there are the treatment modalities like hujama and things like that, which are being practiced keeping in mind the religious view, and we practice those techniques as pain management techniques. So looking at the recap of today's lecture, we have looked at the pain relief and management, its description, difference between acute and chronic pain, different ways to control pain. The techniques which are effective in pain management are biofeedback, hypnosis, relaxation techniques, and acupuncture. So this is all about today's lecture.